Hello, and happy EMS week. My name is Jeff Frankel, and I am the managing editor of JEMS. Uh, Happy EMS week. Joining me today, I have Dr. Thomas Lardaro. He's the EMS section chief at Yale New Haven Health, and he's also repping ACEP today. Hello, Dr. Lardaro. How are you?
Hey, good to see you, Jeff, and thanks for inviting me out here today. It's great to be here.
Great. Thanks for taking time to join us. I know you have a busy schedule over at Yale and everything that you do at ACEP, so appreciate the time. Before we go any further, I would like to say, today is EMS Recognition Day. It's a day that we honor members of the EMS community, both on the ground and in the air, who regularly go above and beyond for what's expected. So thank you for everyone who's listening to us today and watching us. We greatly appreciate all you do. So thank you. Now, Dr. Lardaro, let me start. Let's start with you first. How about sort of about who you are and what you're doing here today?
All right. Yeah, so currently I serve as the EMS committee chair for the American College of Emergency Physicians. I'm an EMS physician and an emergency medicine physician by trade, and previously worked in Indianapolis metropolitan area, Indiana at large, in a large critical care interfacility transport entity, IU Health Lifeline, and recently recruited out to Connecticut to help run EMS in the state of Connecticut and the Yale New Haven Health System. So I caught the bug in EMS at Vanderbilt, training under Corey Slovis, who was the medical director of Nashville Fire Department. I saw the incredible work that EMS professionals do every single day. They rise to the challenge. They're always on call, 365, 24/7. And then I became a flight doc at that time, and just couldn't get enough of it. And so I'm incredibly thankful to be part of such a special profession, working with incredible people every day.
Yeah, great. I guess first question from you is, what does this day mean to you personally, EMS Recognition Day?
Yeah, so for me, you see folks all over the country, whether they're serving, busy urban environments or they're out in austere rural environments, away from any kind of help, serving people everywhere, alleviating suffering, helping people in times of distress, always answering the call. And recognizing those professionals who do this incredibly important work every single day, and come to save lives and help people out in times of distress is incredibly important to me. So recognizing folks on this incredible work that they're doing is very important, and the whole week of EMS week is a great celebration of that the importance of that work.
So I guess the next question is, besides pizza parties, what does meaningful recognition look like to you for EMTs and paramedics? What could be done to recognize them?
Yeah. So, for example, out here this year, next week, we're going to be having a cardiac arrest survivors banquet, where basically we connect the EMS crews, the clinical teams from the hospital, and the patients who survived out of hospital cardiac arrest together, and celebrate those successes and those wins and those saved lives. And it's just acknowledging that teamwork, that through that chain of survival, everybody working together to help people, that it really matters, and the critical role that people that serve in EMS play from the time that 911's called or somebody calls for help to the time they get to the hospital, and even discharged, is just so incredibly important. And so acknowledging that crucial role that folks play on the team, and how we're all one team on one mission trying to help others, I think is incredibly important to me in terms of recognizing this important work.
Speaking of recognized, what do you think the public most misunderstands about EMS?
Misunderstands? Did I hear that
yes. Right? Misunderstands.
I think there's a lot of things that are very abstract about the work we do, and I think it's hard for people in general to really appreciate the kind of profound human moments that we get exposed to with suffering, death, dying, or just people in really tough circumstances. And I think the world doesn't really understand the degree to which that happens until they see it themselves. And these are essentially people's worst days, where somebody's calling 911 and asking for help. And so we don't, most days are not your worst day. And so I think it's hard for a lot of the public to conceptualize how incredibly challenging, stressful, and also how much pressure there is in jobs like this. And that's why it's really important that as a team, we all pull together and support each other, and also recognize this important work and the great things that come from it.
I was curious, before you mentioned, your love for EMS, I think this probably off for recording when we were talking beforehand. I was curious, do you have any one call or experience that reminded you why you got into EMS in the first place? I know you teach a lot. Maybe that. Is it, when you teach, what do you think about? Like, why do you teach? I guess is a good question.
Yeah, that's a great question. So I mean, there's so many times where providing clinical care is incredibly rewarding, and you have these profoundly human moments where you're helping somebody through a tough moment, and you might not be able to cure something or fix it immediately, but you can help them through that moment and get them to a safe place and help them feel cared for. And that means a lot to me. But on the point of teaching, even further, I'll tell you, there's nothing more gratifying than training a class of paramedics and then seeing some of those medics become some of the best clinicians you've ever worked with out in the field, doing incredible life-saving work every single day, or leading the communities they're in and doing this incredible work. And that's that concept of generativity, where you put all this effort and time into building the next generation of people up and helping them do incredible things and even surpass what you might have learned or done in the past. And I feel that, for any of us who've been able to benefit from the knowledge that other people have given to us, or the experiences to learn how to practice, giving that to the next generation of leaders and clinicians is incredibly gratifying and rewarding. And that's one of my favorite things about my job is teaching and empowering that next generation to do incredible work.
Yeah, very true. Now, I was curious, like me, I've been involved a long time with the EMS. How has the perception of EMS changed since you first started in the field?
Oh, that's a good question.
That's
a great question. So, by virtue of being kind of a medical director and a EMS physician and big systems and building systems, I kind of live in a world where I live in the public safety world, but I also live in the healthcare administration world. And while I think EMS professionals, know what it's all about and know what's going on, I think the healthcare apparatus and the large healthcare systems are really starting to understand the vital importance of this work and how critical it is to healthcare delivery throughout the United States. And what you're starting to see is that recognition translating into a further integration and regionalization of care in a way that's profoundly impacting the way we deliver emergency medical services throughout the country. And that's a massive shift that I think is taking place right now. And what you're seeing is a lot more attention being paid to this important work. And now, as a result, you're seeing all these junior leaders coming up too through the ranks, who have new ideas about the ways they want to take things and where it's going to go in the future. So it's an exciting time, and I think it's a time full of change, and I'm very, very interested to see where it all goes, and I'm thankful to be a part of it.
Of course, yeah. Now, I'm curious, what are your thoughts on the future of EMS? You're involved the day-to-day operations at Yale, at ASAP. What's coming down the pike?
Yeah, I think largely we need to think about how we work together within regions or systems, and how we integrate the component parts of not only healthcare delivery within the hospitals, but healthcare delivery from emergency medical services entities and everything in between. And in a world where we historically lived in a place where all the care was done inside the four walls of the hospital, we need to start figuring out better ways to bring the care to the patients and increasing access. And that's where you're seeing mobile integrated health initiatives, any number of initiatives that are trying to get patients healthcare delivered to them. So it's not just, in an emergency setting when they call 911, it's maybe we get out there and prevent things or meet people where they're at and help them live healthier, happier lives.
Now, I think for me, I have really one more question, but feel free to keep chatting. I know a hard deadline on this. I want to talk about mental health. It's an obviously important topic for providers, mental health. What are some small changes, either habits, routines, resources, that you've seen make a big difference in mental health?
Yeah. So I think you have to have a supportive, collaborative team environment. You have to have an environment where people aren't afraid to ask for help, an environment where we proactively, give people kind of a safe harbor to go where essentially they can get the resources and help they need in times of stress and challenge. And we also have to acknowledge how incredibly stressful and high impact this work is. It's just not the same to, go from a job where you're not dealing with necessarily people's lives or the emotions of, again, these profoundly human moments where, people are suffering or levels of anxiety or stress are very high. It's hard to just turn that off in a heartbeat, and so to go from a cardiac arrest response where, things could have gone any number of ways to then another call on something completely different where maybe there's, less than ideal interpersonal interaction on that. We have to be very aware and receptive to the stresses that people are going through, and we need to provide mechanisms to support them through those times so that they feel like they're part of a team. And they have somewhere to go when they're not feeling well and things aren't going right, essentially. So again, support, collaboration, team, and giving people a safe harbor to go to.
Yeah, good point. So I guess I lied to you. That was not my last question. I have many more. I realized that while thinking like, and I don't want to like rush you too fast. And also they come to me as they come to my questions. So I apologize. I didn't even lie to you.
Anytime.
You told a little bit about what's going on at Yale New Haven Health.
Yeah. So I had to be careful because
what can you say publicly, of course?
We're expanding our ability to deliver healthcare resources throughout the state with our care signature, and it's very important to us to integrate all the component parts of the incredible work we can do to try to deliver the best possible healthcare to our patients. And that means at some level regionalizing care and care signature pathways where we basically try to bring the excellent work we can do everywhere. And EMS is a very important component of that strategy. And it's something I'm very passionate about. And I know that our leadership is passionate about as well. So I'm very thankful to be a part of this team while we're going through this exciting time. And you can read Becker's or look through the news things. There's exciting things happening, and I suspect there'll be more to come in the following year.
Mm-hmm. Same question. How about at ASAP? What's going on there?
Yeah, ASAP, we're finishing our 1 year term right now. So one thing I'm particularly excited about is we're providing some new guidelines on how, what types of resources you use for interfacility transfers, or when you need to use an ambulance, when you don't, to help emergency physicians appropriately and efficiently use ambulance resources and not use them for things they don't. Exciting work around the use of blood products in rural and austere environments, and a great dialogue going on there. And then we've got a great collaboration with the National Association of EMS Physicians, which I think is going incredibly well. And there's just so many great partnerships with all these organizations, many of which I probably didn't even mention today, where we're just really trying to drive forward and push the ball forward on delivering excellent emergency care. So it's an exciting time. New objectives coming out this July as we have a new president, and stay tuned because we got some cool work coming through the pipeline.
Yeah, very exciting. I'm looking forward to what's next. EMS is evolving. It's alive. It's doing its thing. Everyone is doing a great job, either in the ambulance, in the air, in a classroom like you are a lot of times, I'm sure now. So I just want to say thank you again for all your hard work, Dr. Lardaro. It was great talking to you. I love hearing all the great things happening at Yale and ASAP especially. So thank you for your time, and we will see you all again soon on our next episode of the JEMS Report. Dr. Lardaro, thanks so much.
Thank you, Jeff. Happy EMS week.
Happy EMS week. Thank you.